Good afternoon, everyone, and welcome to our Healthy Aging Lecture number 6. I'm Nigel Marsh. I'm a Professor of Clinical Psychology here at James Cook University in Singapore. And as I said, this is our 6th presentation in this series, and today we're talking about longitudinal perspectives on successful aging. But before we move on to the talk, there's some housekeeping issues that I need to make sure you're aware of. The first is that this webinar will be recorded for publicity purposes. So we will be recording this. You'll be able to ask questions at any point in the webinar, and you enter your questions in the Q&A function at the bottom of the screen. So when you have a question, just type it in there and it'll sit there. We will go through the questions at the end of the presentations. We're not going to interrupt the presentations, and I'll be going through them and asking our speakers to answer them. There will also be a satisfaction poll, a very quick one at the end of the webinar, and I will talk about that and remind you later. Finally, if you have any technical issues, use the chat button at the bottom of the screen, and that will take you to our technical people who will sort it out for you in no time at all. So on with back to the event. As I said, I'm very pleased to be able to moderate this today. This is the first one of our series where we have a double header. We have 2 speakers on the same topic. Our first speaker is Professor Paulin Straughan, and she's a Professor of Sociology, the Practice of Sociology, and Dean of Students at Singapore Management University. But importantly for today's presentation, she's the Director of the Centre for Research on Successful Aging. And this is a centre dedicated to expanding the health span of Singapore's ageing society. Notice that the idea is health span, not just lifespan. Excuse me. Professor Straughan serves as a consultant on numerous projects commissioned by various government agencies. And this includes the marriage and parenthood surveys that have been commissioned by the National Population and Talent Division. She's published in both sociology and medical journals. And among her publications, she has a book called Marriage Dissolution in Singapore, Revisiting Family Values and Ideology in Marriage, and Ultra-Low Fertility in Pacific Asia, Trends, Cause and Policy Issues, which she wrote with her colleagues Gavin Jones and Angelique Chan. Professor Straughan was a nominated Member of Parliament from 2009 to 2011, during which she argued for work-life balance and the nurture of a more pro-family social environment. So thank you, Professor Straughan. Great to have you here. And also we also have Mr. Micah Tan. Micah is a research associate at the Centre for Research on Successful Aging, which is at the Singapore Management University. He conducts research on the social well-being of older adults in Singapore and how best to enable not just lifespan, but health span as well. He has a keen interest in understanding how social identities evolve through different life stages and the resultant impact of these developments on the individual's well-being. Mr. Micah Tan has a master's degree in anthropology from the University of Oxford and a Bachelor of Social Science Honours in Sociology from the National University of Singapore. So welcome to both our speakers. It's my privilege to be able to moderate this for you, and we're very happy to have you here. People have come to hear you speak, not me. So at this point, I will hand it over to you. Thank you.
Thank you very much, Nigel. Micah, if you would like to load and share screen, let me first congratulate James Cook University, Singapore, for organizing a very successful series on aging research, aging gerontology. Micah and I thought that, since we are the last in this series, we should present applied research in gerontology, and hope that many of you who are listening will be inspired to know that whatever you learn in the classroom, when you translate it successfully, to practical work, you can influence, right, the quality of life for the people who are dear to us. And so in this case, those who are age 55 and above, right? So next slide, Micah. So we thought that we would give you a short overview of the kind of work that our center rolls out. And Michael will share with you briefly two very relevant pieces of work that we have done in the past couple of months. Because we are living in pandemic conditions, we thought that work related to the impact of COVID-19 on well-being of older adults would be most appropriate. And then we will conclude with some top-line suggestions for interventions, and we would love to hear from you, your thoughts, your suggestions, particularly for colleagues who are dialing in from other countries. I would love to hear what is happening on your side of the world, and what are the policy interventions that you think work for you and what didn't work, right? So next slide, Micah. As Nigel has already alluded to, in our research, we are most concerned about expanding HALE, which is health adjusted life expectancy. We hear a lot of rhetoric, in places like Singapore and elsewhere in the world, that population is aging, right? And we feel that we should not see this as a shortcoming, but rather learn how to then receive an aging population, because the older a population is, the more experienced that population is. So how do we garner then, our older adults as resources rather than liabilities? So of course, very important then is for us to leverage life expectancy. So in Singapore, we see a lag, an average of about 9 years, right? We are living longer. Now that's good news, because we are living, many of us in societies where there is improved in lifestyle, medical technologies, and so on. So we can't die, to put it very bluntly. So question then is, how do we ensure that, we can make good use of the expanded life expectancy, right? And so this is what the Center for Research on Successful Aging is, strives to do, right? Expand health-adjusted life expectancy so that we can close the gap and leverage, the gains in life expectancy. So we conceptualize health span as a function of holistic well-being. There are 4 main domains that we cover. Economic well-being, and that I think tends to predominate, right, in the discourse on aging. Most are concerned about, do we have enough money, right, to live longer? Do we have sufficient retirement funds to keep us, in good spirits? So economic well-being is of course very important, but we also argue that social well-being is just as important, right? To be able to grow old and still have your social significance and relevance in the communities that you live in, and how do we leverage on relationships, right? And physical well-being, of course, very important, as well as mental well-being. So the ROSA framework covers health span, as a multi-dimensional construct. What is special about ROSA is we're evidence-based. So we use very high quality, high frequency, longitudinal data to test hypotheses. And from there, we hope to derive a holistic understanding of the different domains of well-being and how they affect each other over time. So next slide, please. This is the framework that guides all our work, right? The anchor is always well-being. So there are 4 broad dimensions, and they feed off each other. So for example, if we are not economically well off, that does not necessarily doom us to poor, low well-being, right, as we age, because there are other domains of well-being that could prop up the overall average, for example. Then what we do at our center is identify the triggers that cause us to trip, and these are natural, right? As we progress on our life cycle, as you go older, things happen. So for example, COVID-19 was a huge trigger, right? None of us expected it, and it was a big, there was a big hurdle that all of us have to leap over. Then we also identify what are the resources that are available beyond individual assets, resources in the community, in the country, right? That could be unlocked to overcome this and offset, right, the negative effects of the triggers so that overall well-being will not dip. The next slide, please, Micah. So a very brief overview on how we collect our data. We host the Singapore Life Panel. The Singapore Life Panel is a representative sample of Singaporeans who are between the ages currently of 56 to 75. We are in the process of refreshing the Singapore Life Panel to include those who are 50 to 55. We have about, at this point, about 11,000, over 11,000 respondents, members of the Singapore Life Panel. We run longitudinal surveys monthly. So this is a very expensive, methodology, but it also yields extremely high quality data. So every month, first of the month, the SLP members will receive the invitation to participate and to log their indicators on the survey. Everything is done online. And so some of you may think, oh, but then that privileges only the educated, the well-off. Nope, it cuts across the entire segment. So for those who could not manage to complete the surveys on their own, we have a team of student assistants, research assistants who will assist them. For those who are not familiar with English, it is translated into Chinese, Malay, and Tamil. So these are the four main languages in Singapore. As of now, we have 71 waves of data because we started in July 2015. And on average, we yield a 70% response rate, which is really very, very, very high, right? So every month we receive about between 7,000 to 7,500 completed surveys, right? Next slide, please, Micah. So this is a very busy slide just to give you a profile of our respondents. These slides will be made available to you, so no need to stare too hard at it, right? But essentially, all I need to highlight is that it is a representation of older adults in Singapore in this age group across socioeconomic status, backgrounds, in terms of ethnicity, in terms of marital status, housing type, education, and so forth. So we watch that very closely. So next slide, please, Micah. So now what I'll do is invite Micah to share with you two case studies that we've completed in recent months, and then after which we can launch into a discussion of how we can improve on well-being of older adults in Singapore. Micah?
Okay, thanks a lot, Prof. Paulin. So as mentioned, I'll be presenting two case studies of research that the team at ROSA has conducted in the past year. So the first piece of research was conducted at the beginning of this year and focused predominantly on trying to understand how COVID-19 had impacted older adult well-being in Singapore so far at that point in time due to the pandemic, as well as due to lockdowns and restrictions and so on. The second piece of research is more recent and focused on vaccination rates among older adults in Singapore, which for those of you who are in Singapore would know has been a topic of interest as of late. So these two case studies will hopefully illustrate for you how we operationalize the framework that Professor Paulin presented, and also more generally the aims of the applied research that we conduct at ROSA. So beginning with the first case study, a lot of the motivation for looking at older adult well-being during COVID-19 was really based on the fact that early commentators had identified older adults as a population that was particularly vulnerable to the effects of COVID-19, not just in terms of contracting the virus, but also in terms of having a more difficult time adjusting to restrictions and lockdowns and so on. So for this reason, we really wanted to explore two main issues. Firstly, how older adult well-being have been affected by the lockdowns and the pandemic, and also secondly, to identify the different factors, more specifically that had exacerbated or maybe even mitigated this. And this was particularly important at that point in time because lockdowns were, of course, extremely novel, and we wanted to help shed light on the situation and also inform policymakers on how really best to help older adults to cope with the changes that were brought about by the pandemic. So in order to explore these issues, we collected data on a series of different variables that we felt would help to elucidate exactly how older adult well-being had fared during the pandemic and during the lockdowns. Firstly, we had overall life satisfaction, which we used as a measure for well-being among our respondents and also as our main primary dependent variable. A single item instrument was fielded and respondents were asked to rate their overall life satisfaction on a 5-point scale. The second significant dependent variable that we were looking at was also subjective social isolation or loneliness. And this was measured in terms of the frequency at which respondents felt socially isolated, and similarly, respondents answered on a 5-point scale. We also looked at living arrangements because we were definitely interested in comparing the differences in well-being between older adults who live alone versus older adults living with co-residents. Next, we also looked at the use of communications technologies by our respondents, both in terms of the usage of different types of communications technologies, as well as, of course, the frequency of digital communications that these respondents had with their friends and their families. So in terms of usage, respondents were asked to indicate which of 6 forms of communications technologies they use to keep in touch with friends and loved ones. And the sample was subsequently split into 2 groups, the first containing those who use one or no forms of communication, and the second group containing those who used 2 or more. In terms of the frequency of contact, respondents were asked how often they communicated with friends and family digitally, and respondents answered on a 5-point scale. Finally, we also looked at the participation, the frequency of respondents' participation in in-person social activities. This may not make as much sense to look at first because we were really focusing on older adult well-being during 2020 when social activities were quite heavily restricted, but we did notice that some respondents were actually still able to continue with their social activities, and definitely more so than others throughout the year. So it was still a variable of interest for us. So for this particular variable, respondents were rated their frequency of participation in 7 different activities, including things like visiting their friends or family or participating in religious activities. And they rated their frequency of participation in each activity on a 5-point scale. And subsequently, the scores for the 7 activities were summed to create an overall social activity score or index. So these were really the variables and constructs of interest that we identified. Subsequently, what we did was to look at conduct a preliminary analysis to try to see if they were indeed significant in determining older adult well-being during the pandemic, especially during last year in 2020. So first of all, we looked at the overall trend in well-being or overall life satisfaction among our respondents last year. So as can be seen, there was quite a significant dip in the levels of well-being among our respondents in April 2020, which was precisely when the first lockdown, or what the Singapore government referred to as the circuit breaker, began in Singapore. After the circuit breaker ended in June, we observed that well-being did recover slightly. However, importantly, it did not actually recover to pre-COVID levels, which can be seen or observed in the months of January and February in this chart. In fact, we also see that well-being more or less plateaued after the circuit breaker ended and during the transitionary period to phase 3 of Singapore's reopening in December at a level that was below pre-COVID levels of well-being. So what this really indicated for us initially was that older adults were likely to still have been facing significant impediments to their overall well-being even after the initial lockdown or the circuit breaker. We also observed some interesting trends in well-being when we zoomed in on specific dimensions of well-being. So in particular, when we looked at, for instance, satisfaction with health. So as you can see, satisfaction with health didn't actually drop during the circuit breaker as overall life satisfaction did. And in fact, it remained quite consistent with pre-COVID levels. And initially, this did puzzle us quite a bit, as we had also found in a separate piece of research that a number of our respondents had actually faced disruptions in their healthcare provision as a result of the circuit breaker. And so what we were actually really expecting to find was that satisfaction with physical health would have declined similarly as overall life satisfaction did. However, through several qualitative focus groups that we ran with our respondents, which is actually also a separate methodology that we do employ at ROSA, we discovered that several of our respondents had actually found it easier to lead healthier lifestyles during the circuit breaker because they had more free time due to the shift to working from home. So, for instance, two of our respondents who have diabetes, they remarked that when they started working from home, they used the extra time that they would have normally used traveling to and from work to actually develop a daily routine of taking walks around the neighborhood as a form of exercise. And in adopting this particular routine, they actually experienced significant improvements in their health conditions. So what this point really illustrated for us was the importance of examining well-being as a multi-dimensional construct and looking at different dimensions of well-being concurrently, as certain stresses, in this case, of course, the circuit breaker may actually impact different dimensions of well-being in different ways. On another note, this really also illustrated for us that as much as COVID-19 has been incredibly disruptive for older adults, there are also certain lessons that we can learn from the pandemic in terms of how we can actually try to improve the overall well-being of older adults in Singapore as well. So in this particular case, we of course discover that allowing older adults to have a better work-life balance would really afford them the time and energy to actually take better care of their own physical health, which potentially leads to overall significant improvements in their overall health and well-being. So next, we dove a little bit deeper and compared the well-being of those living alone to those living with co-residents. As can be seen, the well-being of those respondents who were living alone, represented by the green line, was consistently lower than that of those living with co-residents throughout 2020. It also appears that those living alone experienced slightly steeper declines in well-being during the circuit breaker. So these findings really confirm for us that restrictions on social activities really impacted older adults who live alone a lot more than those who live with others. And so we identified more socially isolated older adults as a population in need during the pandemic last year. Several reasons may, of course, account for the fact that older adults who live alone find it harder to cope, but most likely is due to the fact that even during the circuit breaker, older adults living with others could still interact with other people on a daily basis, and those living alone would have been truly isolated and would have had minimal contact with others during a circuit breaker, unless, of course, they were able to resort to other forms of keeping in touch or other ways of keeping in touch with their social contacts, for instance, through the use of digital technologies, which thus leads us to our next point of inquiry, which was to look at how the usage of different communications technologies may actually have impacted or influenced well-being last year. So as can be seen, those who use only one or did not use actually any forms of communications technologies to keep in touch with their friends and family reported lower levels of well-being consistently as represented by the blue line. We can also see that the gap in well-being between the two groups has widened slightly since the pandemic began and during the transitionary period after the circuit breaker. And so these differences possibly do or did preliminarily confirm that being able to use a greater number of forms of communications technologies actually did make it slightly easier for older adults to maintain contact with their friends and family and to perhaps socially interact during the lockdown, despite restrictions on physical or in-person social activities. And finally, of course, we looked at differences in the well-being between those who could still remain relatively socially active last year and those who are not able to continue participating in in-person social activities. As can be seen, there's a wide difference in the well-being between these two groups, and with those, of course, who are able to continue social activities, reporting higher levels of well-being. This difference in well-being has grown, seems to have grown even wider in the months following the circuit breaker during the transitionary period into phase 3, which suggests that the importance of engaging in in-person social activities for one's well-being. The increasing divide in well-being between the two groups could perhaps be due to the fact that working from home more or less became the default, which perhaps may have made engaging in such social activities all the more important for the well-being of older adults as they lost the opportunity to socialize at work. So these preliminary descriptive analyses really identified several key factors in determining older adult well-being during the pandemic, namely living arrangements, the use of communications technologies, and the frequency of engagement in social activities. For this particular reason, we decided to carry out a deep dive analysis of the factors mitigating the impact that living alone had on well-being for older adults using path analysis. Notably, we did opt for cross-sectional analysis of the November 2020 wave data to facilitate this particular piece of analysis. So in terms of the path analysis, we developed a hypothesized model that is displayed on the screen with four main hypotheses. So beginning on the left, based on our preliminary findings, we first hypothesized that living alone would directly predict the level of social isolation that respondents felt. For hypotheses 2 and 3 in red and green respectively, we hypothesized that the frequency of digital contact and tech use, as well as the frequency of participation in social activities, would actually mediate the relationship between living alone and social isolation. So in particular, we had hypothesized that those who lived alone would actually resort to using more digital contact due to the fact that most of their social contacts would be living apart from them, and subsequently that this digital contact with them, with their social contacts, would actually decrease the level of felt social isolation. And for the same reason, we had also hypothesized that those living alone would also choose to participate in more social activities, which would in turn decrease social isolation as well. And finally, for our last hypothesis, we hypothesized that these factors, together with the level of social isolation experience, would also have a direct impact on the overall life satisfaction of our respondents. So moving on to the results of our path analysis, you can see that we did yield some interesting findings. Firstly, we found that living alone did significantly predict the level of social isolation that respondents felt. In particular, those who lived alone were more likely to feel socially isolated. Secondly, we did also find that those who lived alone tended to, as we had hypothesized, participate in more social activities, which in turn actually reduced the level of social isolation that they felt. However, as for the frequency of digital contact, contrary to our hypothesis, we didn't find that living alone predicted the frequency of digital contact with their friends and family, meaning that those who lived alone were neither more or less likely to keep in digital contact with their friends and family in November last year. Subsequently, however, digital contact was still found to reduce the level of social isolation that respondents felt. One possible reason that may account for the fact that older adults who live alone may not actually resort to using more frequent digital contact in order to make up for their lack of physical contact could be due to the fact that older adults are in general less technologically savvy and therefore may not have known how to use digital contact as a substitute. And this is supported by the fact that we did find also that the number of communications technologies that older adults used did actually significantly predict their frequency of digital contact with others. And of course, finally, also we did find that the frequency of digital contact, participation in social activities and social isolation all predicted the overall life satisfaction of our respondents. So what the findings of our path analysis really illustrates for us is that during the period of COVID-19, where restrictions on social gatherings and activities are in place, were in place and are still in place, two potential points of intervention that stakeholders can adopt in efforts to improve well-being would be firstly to try to encourage older adults to keep in touch with their friends and family digitally, and secondly, to try to increase their participation in social activities, especially for older adults who live alone. However, particularly in terms of the effectiveness of digital contact, we did find, as mentioned, that older adults may not actually have the skills to take advantage of this. So, and so one recommendation would be actually for stakeholders to try to find ways to educate older adults to use these technologies in order to keep in touch with their loved ones. As for social activities, definitely increasing social activities during the period of COVID-19 where older adults are more or less discouraged, or definitely discouraged more to leave the house less, is not the most straightforward proposal. But our findings really do illustrate how important social activities are for those who live alone in reducing social isolation and increasing overall life satisfaction. So it is quite important, in our opinion, for stakeholders to, where possible, develop adjusted social activities for older adults who live alone that will still meet the restrictions. So, for instance, at least in Singapore, many large scale or larger scale events at community clubs that older adults who live alone may have previously frequented often were cancelled due to COVID-19, but perhaps a possible alternative could be to develop smaller scale events and initiatives that could run during this period and that older adults living alone can still participate in, especially as and hopefully as the pandemic progresses and restrictions do lighten up. So going back to the overall purpose of our talk today, which was to present the framework that we have adopted for studying well-being among older adults, we can see how the different elements and factors do fit into this overall framework. In particular, we looked at how several stresses such as the pandemic, the circuit breaker, and social isolation can impact well-being. But at the same time, we also identified several resources or intervening factors that mitigate or sometimes even worsen the effect of these stresses on well-being. In identifying these factors, we also therefore identified key points of intervention that policymakers can target in order to improve the well-being of older adults in Singapore. And so, given that translational research is quite a key aspect of Rosa's work, we do think that this is quite an effective framework through which we can improve well-being for older adults in Singapore and try to enable a health span. This piece of research also does illustrate for us the value and efficacy of high-frequency longitudinal studies as well, as without the monthly frequency of the data, we would not have been able to identify in as much detail and on such short notice the different factors that really influenced older adult well-being during this particular period. And this point is actually also quite nicely illustrated by the second case study that I'll be presenting regarding vaccination rates, which I will now quickly move on to. So vaccination rates for those in Singapore has been quite a topic of interest in the past few weeks due to the fact that older adults in Singapore have seemed to be the population that is most resistant to getting vaccinated. At Rosa, we had actually began tracking vaccination rates among our respondents once we had noticed that the shift towards vaccination had begun back in February this year. So we were actually fortunate enough to be in quite a good position to offer policymakers some insights into how exactly we might be able to encourage more older adults to vaccinate. This involved firstly trying to understand which populations were more hesitant to vaccinate, as well as the reasons why they were hesitant in the first place. So we began with looking at, of course, the overall vaccination trends, and we had asked respondents which of the 4 categories of vaccination status they had belonged to since February, in particular whether they were fully vaccinated, partially vaccinated, waiting to vaccinate but planning to, or whether they did not plan to vaccinate at all. As you can see, we did manage to track quite closely the vaccination rates among older adults aged 56 and above. Once the COVID-19 vaccines were made available to our respondents beginning in March, we do see that vaccination rates increased quite sharply initially. However, we do also notice that the vaccination rate has been increasing at a slower pace as the months proceeded, indicating that there is currently perhaps a greater resistance to being vaccinated among the remaining unvaccinated older adults. So in other words, that the remaining unvaccinated older adults may actually be harder to convince in terms of getting vaccinated. So this really led us to think about or wonder why these older adults were resisting vaccination. So for those who said that they plan to vaccinate but were waiting, the most cited reason for doing so was that they were actually afraid of the side effects and really wanted to see if any reports of significant negative side effects of the vaccine would be published. And this was congruent with what we have been reading lately about that many of these older adults actually are quite afraid of the side effects, especially due to the fact that they are older in age and may suffer from chronic diseases and so on, which makes them a bit more wary of the effects of the vaccine. We found a similar trend among respondents who said that they did not plan to vaccinate, and notably, the most cited reason for not wanting to vaccinate was similarly a fear of the side effects. And as can be seen from February to June, the proportion of respondents who cited this reason remained quite consistent despite the drop in the absolute numbers. So in general, these 2 findings were actually quite useful for us because they dispelled this general idea that older adults were not getting vaccinated because they believed in, for instance, conspiracy theories and were in general anti-vaccination, as is the case in some other countries, including the US. And instead, what we found was, of course, that older adults were actually hesitant because of a fear for their health and of the safety of the vaccine. So what these findings really showed us is that rather than being critical of these older adults, what is needed is a sense of empathy in order for us to be able to reassure these older adults. So the next logical question after discovering this was then how we should try to actually encourage and reassure these older adults that the vaccines were safe. And so we ended up looking at three different factors. Firstly, the various sources of information that our respondents relied on or used for information on COVID-19, how much they trusted these sources, and finally, their level of social integration as measured by the number of close contacts they had, as well as their household sizes. So for the sources of information that our respondents used for news and knowledge on COVID-19, we had actually asked respondents back in November 2020 what sources they were relying on for information on COVID-19. And we linked their vaccination status in June 2021 with their responses in November 2020. When comparing the sources of information relied on by respondents who were fully vaccinated and those who did not plan to vaccinate, we found some interesting trends. Specifically, respondents who were fully vaccinated in June 2021 were much more likely to have said that they rely on government sources for information as compared to those not planning to vaccinate. This was similar for the use of newspapers and the TV or radio, although the differences in usage for these sources was smaller. Additionally, we did also find that respondents who did not plan to vaccinate were more likely to rely on personal conversations with friends and family, as well as their own sources, internet research for information on COVID-19. Quite interestingly, there were minimal differences in the usage of social media between these two groups, which other studies have actually found to influence the willingness to vaccinate. Perhaps this could be due to the fact that our sample and our study pertains mostly to older adults who may in general be or may not use social media as much. In terms of the trust that respondents had in different sources of information, we similarly see quite significant differences between those who were fully vaccinated and those who did not plan to vaccinate. In general, those who did not plan to vaccinate were less trusting of all sources of information across the board, but most significantly when it came to news on the television and on the radio, as well as for government sources. Additionally, and quite interestingly, we also found that respondents who did not plan to vaccinate actually placed the highest level of trust in their family as a source of information for COVID-19, sorry. And finally, we also found that respondents who were more hesitant to vaccinate were also more likely to be less socially integrated, as represented by the greater likelihood to have fewer close contacts as well as a smaller household size. Separately, although this isn't displayed here, we had also found that respondents who did not plan to vaccinate were also more likely to be living alone. So taken as a whole, our findings on the vaccination trends really highlighted for us several key points. In particular, that social support and family are important factors when it comes to encouraging older adults to vaccinate, both in terms of the level of trust that respondents place in their family and close contacts for information, as well as more generally their social integration and embeddedness within their community. And this was really congruent with past research that has found that social support is quite a key factor in encouraging people to adopt positive health behavior. So these findings really highlighted for us also a significant gap in the government's initiatives to encourage older adults to vaccinate that had relied mostly on top-down public health announcements to that point, which, as we can observe, would not be as effective because many of the older adults who are unwilling to vaccinate wouldn't actually trust these sources as much. So instead, what we recommended was that authorities should actually work through the social networks of these older adults to try to assure them of the safety of the vaccines and to encourage them to get vaccinated. And for those living alone, we also recommended that the community in the form of volunteers should really step in to try to play this role. And these recommendations were subsequently communicated to the relevant ministries. And we did observe that authorities did actually start to adopt a more ground-up approach to encouraging older adults to vaccinate. So that's really all I have to present on the two case studies of our research, and I will now be handing the time back to Professor Paulin, who will be concluding our lecture.
So I thought it's useful to now pull back, right, from these two specific studies and ask, broader questions. The first, of course, is to highlight that when we look at older adults, a very important reminder that it is not a homogeneous group. Right. So first and foremost, we would have to recognize that the group is, fairly diverse, both in terms of their resources and in terms of, what their pressing needs are. Of significance in Singapore, of course, we've been tracking two types of households: those who are aging in older persons only households, because this is a great for those of us who live in Asia, right? The myth, the great family myth is that you have children so that when you grow old, they will be in the household taking care of you, of your needs and so forth. But forget it, people, it's not happening anymore, okay? Because of the shift in the expectations of our younger members of the community, shift in expectations of marriage. We now see that the respect for privacy, appreciation of privacy, etc., have all resulted in many even if they're married, right? Married adults are growing old just with their older spouse, right? And then of course of significance for us too is that the group who remain single either by choice or by circumstance, and they age alone. So I think this is a very important data point to flesh out, because the ideological stance, at least for a place like Singapore, right, we had always, wanted to believe that family takes care of its vulnerable members. So by looking at this data from an evidence-based perspective, we now flesh out the fact that as we receive an older population, a graying population, we have to look out for those who are aging alone. And therefore, when we say we want to promote aging in place, this means that we are looking then at who will take care of those who are living with some levels of disabilities if there is no younger person living in the same household. And of course, as always, those who grow old without as much resources, right? Where are they concentrated, and how can help be streamed to them? So typically, because in terms of interventions, right? I mean, sociologically, there's lots of things that we can tease out, but then because I think the merits of good translational work is to be able to flesh out, right? These are vulnerable groups that we need to attend to, but how do you identify them? If you say, for example, if you use education, now you don't know if you're in the community who has high education and who has low education. Very difficult for you then to, have targeted, interventions that will reach the right people, right? Otherwise, it's a waste of resources. So in Singapore, we use housing type, because then you can go to housing estates. If we can, so what we have identified is those who live in smaller housing types, 1 to 3 room HDB flats. They are the ones who are likely to be aging alone, and they are the ones who are likely to have less resources. So therefore, intervention should be targeted in housing estates. And then the second, I think, important takeaway for us really is to look at what are the best interventions, or what we think, from the data, right? The most effective interventions for specific effects, negative effects, right? Triggers, that bring well-being down. So for the first case study showcases the importance of technology. So Singapore then immediately tried to step up, right? To bring digital connection, particularly to older households. So we have written quite a bit on that, because we argue that it's not just being hardwired, right? Having Wi-Fi connection and all that. It is also, to have that software, to have somebody available to teach the older adults how to use WhatsApp, in a responsible manner, how to, engage social media and not be duped by social media. So I think that is something that, we are continually to work on. And so the question is that how do we reach out to those who don't have younger family members to guide them? Increasingly, we're looking at the pool of volunteers that we could leverage on, right? Then the second case study, points us to how to better reach, the hard to reach segments of the population. Typically, we think that if we broadcast mass media, right, through television, newspapers, and so forth, that should do. I think it does work for most of the people. However, for the hard to reach, again, it comes back to, how can we get to them, so that there's a more personalized approach. Because from other research on pro-health behavior, we find that when the message is delivered by somebody whom they trust, they're more likely to act on it, right? So we see that, the trust in news sources may not be as high, but the trust in a family member or a significant other is higher. So here is where, while we rely on broadcast news, right, to send out messages, we must not forget that the soft touch from social networks and social support groups are equally important. So a duality of, I think, responses. I think we should leave some time for discussion. We have to flash up the last slide. We always must acknowledge our sponsors. So this is sponsored by our project, is arising from a Ministry of Education Tier 3 grant, and also supported, very importantly, by the Ngee Ann Kongsi. Thank you very much, and we're happy to take questions, Nigel.
Thank you. Thank you very much for a really great presentation. I mean, you used the term translational research, and it's something I try to teach my students about in research methods, but this is a living example of getting methodological rigor across to have meaningful and current messages for how to conduct things and interventions we can make in society. So thank you for that. We've got 9 questions, and Professor Straughan has been that efficient. She's actually answered 4 of them live.
Happy to revisit those answers, because I was trying to type fast and listen to Micah at the same time.
I wonder if it might be useful for the audience if you don't mind, if we just go through them. So the first one. So the audience, there was the finding that adults were taking the time to take care of their health while working from home. Looks to be an important indicator for employers. Have you had time yet to formulate recommendations on this?
Yes, so as I typed in the chat, we think that work from home is a big deal, right? Because when we were fighting for work-life balance, so throughout my career, right, as a family sociologist, we've been, looking at the construct of work-life balance, and we think that is a very, very important element that we have to, appreciate and really respect, right? That work cannot, use family time as surplus over time, right? So the argument then was that, oh, not possible. And a lot of employers were very reluctant to engage, flexible work options. FaceTime was a big pain in the rear, right? If they don't see you in the office, it's like, no. If you're not clocking in at 8:30, oh my goodness, if you dare to leave before 6 o'clock. So all that fear, unnecessary fear, and employers, some employers were just not able to move away from the traditional modes of assessment, which is really just, looking at you, making sure that you're sitting at your cubicle. And then, without much warning, we were thrown into circuit breaker. I remember that very clearly, 5th of April, because that was the day when this thing called circuit breaker was announced, and then we were not allowed back into the office. And many colleagues were gathering, pulling out laptops, and then some were like, I don't have a laptop, what do I do? Go home, just go home, right? We'll come back. And then we learned the hard way, right? There was no choice. And so businesses, organizations learn how to function from remote places, right? And those who could not failed. They no longer exist, right? Unless you're frontline staff, right? Businesses who are not frontline, who are not serving frontline needs, and they couldn't pivot to online platform, they all died. Okay, and very sad, but so for those businesses who are thriving now, who are still doing well, they've obviously found the answer that it is possible to do a lot of our work, off-site. So in the process, then we learn how to trust each other, right? Trust our teammates, trust our reportees, and I think that is a positive move forward. So and then with work life, and with working from home as a norm now. So for those of you who are not in Singapore, we are still working from home. We're not allowed to go back yet because of the second wave, right? Of Delta variant being so powerful. So it has, when you work from home and you have fair demands from your supervisors in an average work day, right? Only so much can be done, and you do it. It costs you time to take care of yourself. With older workers, this is very important because for many older workers, through qualitative interviews, we find that many of them are not seeking for very high remuneration, especially the older ones, right? Those who are post 62, even post 65. All they want is a job that allows them to stay relevant and socially significant, but also time for themselves, because they need to take time to look after themselves. And so many are asking for, that flexibility. So I think this finding, tells us that it is important, not just for older adults, but particularly for those, who have contesting demands on their time and who need some time to look after themselves, that flexibility, in paid work is really much appreciated. And this is something that I hope post, in the endemic, right? We will be able to see a lot more flexibility where we can have what I've called a 2+3 or 3+2 model, where you go back to the office for 2 or 3 days, and then you are able to continue to work from home the other days. And perhaps, this is the answer as we learn how to cope with an aging population, which means that we have to keep more older workers in the workplace, right? So in Singapore, we went from, when I was growing up, and my mom is a nurse, right? She retired at 55. And she's 88 right now. So she had that 30 years, where she was pretty healthy most of the time, and she's still healthy, but 30 years where she exited the workforce. Now, the retirement age is 62 going on to 65, and then moving progressively to 67. Is that good news? We need to be careful, because if we keep, using the expanded life expectancy as surplus labor, right, time, I think then we really end up, we are just living to work, and then we work till we die. What a terrible life, right? So I think we need to be respectful of retirement. We need to be respectful that as we grow older, individuals with resources would like to be able to spend more time on other meaningful aspirations. So the flexibility in paid work, having that model that allows part-timers and as well as full-timers to be able to work on a flexible, work schedule, that is certainly something that we will continue to push for as meaningful intervention, Nigel.
Thank you. I think what we might do, we'll keep going through these. Because the next one was more of an effect size thing. While I respect the statistically significant differences between groups on life satisfaction, scores were between 3 and 4 on a 5-point scale, with 3 being a neutral option. How much practical difference does that represent in terms of a useful interpretation for recommendations?
So this is a methodology question, right? Rosa started in last year in 2019. When did we start Rosa, Michael? Last year is 2020, right? We started in 2020.
July 2020, right? Yes.
Yeah. So before Rosa took over, it was CREA, so the research center, right? So my predecessor was an economist. And so CREA focused primarily on economic well-being. right? So when we took over, when my team took over last year and we brought in, the other 3 dimensions, we've been progressively expanding the well-being indicators. So I think our viewer is right that using singular indicator is certainly not sufficiently robust. So we have been building indices, right? So generally, we are relying more on multidimensional scales to measure well-being rather than individual items. So you will see more of this work if you follow our work. Just stay with our website, because every time we come up with top line, we will publish it on the website and you can download it for free. Okay.
Thank you. Okay, the next question was introversion, extroversion taken into account for people living alone or working from home? If not, how do you think it might affect the observations?
I must say, Nigel, I must confess, okay, I didn't understand the question. What is introversion and what is extroversion? What does that mean?
Unfortunately, it's actually quite a dated construct, and people have quite a simple understanding of it. So an introvert is a person who lives in their own world.
Okay.
Extrovert is a person
Yes.
who has to be part of a crowd. And there was some research in the 70s and 80s that looked at the difference between Western and Eastern cultures in terms of introversion and extroversion. It's a lot more sophisticated than that now. But I think what the question means is that if I don't like mixing with people, am I happy living at home on my own?
Yeah. So our psychologists, so we have a team of psychologists, they have included a whole host of personality measures. So in this research that we have shared, we have not included that in, because as you could see, it's very top line at this point. So the psychologists have been going deeper into the various attitudinal personality traits perspective. So another reason for you to keep our website on your bookmarked list, okay? They will be sharing their papers on the website as well.
Thank you. The next question is about if ICT helped older adults who did not have adequate social networks as much as those who did. So to what extent did ICT change things, or did it just add to existing differences?
So we're talking about communication, right?
Yes.
Yeah.
Sorry, the apps and stuff.
Yeah. So we found that those who engage in at least more than one form of means of communication, which is usually the telephone, right? They are more likely to stay connected. So I think that this in a way, we're talking about a digital connect, right? Whether or not if we bring these households onto the digital platform, then with more options of keeping in touch with news and family and friends, right? It should ease the social isolation and loneliness, right? When physical connections are not allowed yet. That certainly the data points to that those who are more data savvy, digital savvy, seem to be better off when it comes to general well-being. However, the other concern that we've had, and of course the news also points to this, is that while we are in a hurry to try to push everyone onto a digital platform, right, banking, etc., I think we also must take time to ensure that all these particularly older folks are also adequately educated on on safety, right, on the digital media, because many are not. So I think so in addition to pushing them on, and it does help, but we are also mindful that the digital savviness must also be part of the program, that they don't then end up becoming prey to fraud, right, and other kinds of mischief makers who are certainly present on the social media platform. So my mom, right? My mom is 88 years old. Thankfully, we bought her an iPad and got her an iPhone right before the circuit breaker. Oh my goodness, poor mom, right? And mom is a nurse, okay? So she's not, she's educated, she's a nurse, and her friends are sending things to each other. At some point, it was sending, circulating myths, right, about the pandemic. And I said, Mom, we have a law here, right? That if you circulate false news, okay, you could get, police would come. So don't share all these weird things that you are researching. She goes like, but my friend sent it to me. I said, I don't know where your friend is getting it from, Mom, but don't circulate, right? And don't believe everything that you receive through WhatsApp and on your Facebook. And that made her very nervous. But so a balance, right? How do we, and I mean, be educated, get educated user of social media. It's not limited to a specific age groups. Our youths are the same, right? We're so easily swayed just because it is, in print in social media. So I think general caution is important. But to answer the question, yes, it does help being connected on ICT. There is a class divide, certainly, right? So we are mindful of the class divide, and therefore, at least in Singapore, the government has taken it, as part of their responsibility to wire up those who are in the lower income households.
Okay, thank you. The next one is sort of related, I suppose, to your mother and the disinformation. And this question is saying, older adults in Singapore have had half a year where they've had consistent messages from the government, and they've had consistent messages from their family and friends who have been vaccinated, and this hasn't worked. So what other channel can we use? They've had enough information from these sources, but it hasn't worked.
Yeah, it's a tough one. Because we take lesson from the mask, the utilization of masks, right? Because Nigel, you were in Singapore, in the beginning we were told you don't need a mask if you're not sick, because there were not enough masks, right? So therefore, part of the rationale is you save it for the frontline workers and those who are ill, right? So if you're not sick, I think first case of COVID we were alerted to the first case of COVID in January. And then in February, there was enough concern and noise about it. And I remember when I was going shopping at Ion and I see some people with mask shopping, and I had made the rude remark to my family. I said, if they can come shopping, they're obviously not sick, so they shouldn't use masks and waste masks. We need to save the mask for our frontline workers, right? And then, of course, that quickly changed when we first of all learned more about how the virus is transmitted, and then plus, of course, that step up production, right, in quality masks. So when the message shifts, it caused a lot of confusion, right? So then again, another, there was a lot of effort put in telling people when masks should be used appropriately and when we shouldn't be using masks inappropriately. And then, when the messages had to be recalibrated again, that massive onslaught of, just pushing out the right messages, making sure that, no one is left behind, in the updates, right? So I think what we are seeing now is the fatigue. For example, just the shifting of the restrictions, safe measurements, safe distancing measures. What is SMM, Micah?
Differentiated safe management measures. Yeah, I think
safe
so.
management measures, right?
Yeah.
So even the echo names, right? I am trying to, try to stay cool with it, right? So there's a lot of shifts, from opening 2 to dine, 5 to dine, no one to dine, that kind of stuff. So there is a fair level of confusion on the ground. And we have to appreciate that is what a pandemic means, right? That things are emerging, as we learn more, things are shifting very, very quickly. So it is a challenge for public health. It is a challenge for messaging. So what is important for then the community players would be to identify the nodes of influence in each community, because you can't reach everyone the same way, right? Mass messages will reach people who read the newspapers, turn on the TV, who are literate and who want to keep informed. But then there are many who don't read the newspapers, who don't tune on to the TV, and who generally have a mistrust, right, of government, right? So how do we reach them? So another important module that Rosa has is on networks. So in the networks module, we ask deep questions on social connectedness. You know, how many close friends you have, how many close family members you have, who are these people, how often do you connect with them, do you trust them, etc. So once we identify the nodes of influence, then I think the messages that we stream out, we need to identify the community busybodies and get the community busybodies to go out and put a face to that message, right? So with that network module, we are now stepping up on the volunteers module, because part of an aging population is that tremendous resource that we have in the retirees, right? In Singapore, the baby boomers have entered the post-65 age group. And the baby boomers are very different from those who are in their 70s and 80s and 90s. These baby boomers, they're educated, they are prepared for retirement. So many of them don't have to work, right? But they want to stay relevant. And they have years and years of work experience. How do we tap on this group? We need to grow an appreciation of volunteers. And so with volunteers, you know, becoming the main point of contact in communities, I think that's where, you know, when we say bringing back the kampong spirit, that's what it means, right? To have within small enclaves in our neighborhoods, we know who the key volunteers are. You know, respectfully calling them the busybodies of your neighborhood, because they will be the ones who are connected, who have information, and who will be trusted by neighbors. Yeah.
Thank you. I know we're a little bit over time, but if you don't mind, we'll take a couple more questions.
Sure, no problem.
We've got one about the effect of social isolation on physical health, and did you find a relationship on that between those two variables?
Yeah. So Michael, we have looked at social isolation on self-reported health, right? There's a correlation there, isn't it? We didn't present it in your model here, but
in general, yeah, more
Yeah.
isolated people do tend to have lower levels of physical health, but we haven't actually looked deeper into that yet. But we do plan to, yeah.
Yeah. So I think again, right, this notion of social isolation, if you choose to be alone, that's a different thing. But if it's by circumstance that you are alone, right? That becomes an issue for us, because we track the proportion who are living alone as they grow older in Singapore. We're at about 10% now. The latest census, right, shows us. So this means then that at some point, no matter how much they enjoy being by themselves, disability step in, right? Then how do we care for them if they're living alone? And it can't be institutional care, you know, because it's very expensive. So again, we're looking at community self-care. So we have a couple of projects now that we put in a grant for, to look at two things. First is, how do we manage self-care via technology? So very important for those who are living alone, right? If I'm living alone and I don't really, you know, I don't want to hire a helper, and I'm generally quite okay living alone. However, I am now, you know, in my 80s, and there are disabilities stepping in. What happens to me if I need something, right? So we're looking at the possibility of developing an app. There are many apps out there. So how do we pool all the, you know, knowledge together and come up with the mother of all apps, right? That is affordable, you know, that will alert us. So rather than having individual helpers in each household, we're saying let the app connect all these, you know, older adults to a community-based centralized health center. Right? So then volunteers can go out, right, and so forth. And then, of course, the other would be, you know, how do we grow community ties that can replace the absent family ties, right? Yeah.
Yes, thank you. There's a number of comments here that I'll just summarize, basically agreeing with the difficulty of teaching tech to older adults sometimes, and the importance of them trusting the source of information. One of our listeners has wanted to share that they've been work done in the Philippines where they've shown the effect of significant others on vaccine hesitancy and that sort of thing. But the last formal question I think we've got is about the impact of delaying retirement. So does delaying retirement mean that qualifying age for support should be pushed back? And how does that affect targeted support to HDB dwellings?
Yeah, so that's a very important question, because I think in recent years we have just been euphoric about extending the retirement age, right? Because for older adults, it's like, don't force me to retire, because I'm well and I want to continue, working because I need the money, right? So that has always worried me, because being prepared for retirement is an important state of our affairs, right? And you can only be prepared if you know years ahead that there's a finite end to that monthly income, right? So and therefore you make plans and you learn to spend less, grow more, and so forth, until come to a point whereby you're able to say, I don't need to work if I don't want to. I can work, just to enjoy, being socially engaged, but I have sufficient savings. So this is one of the shortfalls of, the approach that I think many of us have come to rely on, that we don't save enough, but we keep lobbying government to extend retirement, right? Not very healthy. So not a very healthy option. Nonetheless, I certainly do not trivialize the need for many older adults for a regular income, simply because hardworking as they have been in their youth, things have just gotten so expensive, and especially when poor health steps in, and especially when we have dependent others who have been needing our support and care and resources, many older adults, unfortunately, just don't have sufficient to retire. So what we have been working on then is productive aging. Together with some of our esteemed colleagues. You might know her, Ursula Straughan, who is in Germany. And so we've been exploring this idea of, finding out more about productive aging, the kind of work, that we engage in, for example, non-routine work that keeps the mind active and healthy. So, right now, how we engage older workers is we give them mundane routine work, because we in our ignorance, lack of evidence, think that that's the best thing for them, right? Oh, because they're so old, don't complicate things. Just tell them, push this button, and off you go. But research has shown that non-routine work is better, for keeping the mind agile and healthy. So increasingly, we're collecting more evidence on this, but our stand is older adults are certainly an important resource for a small country like Singapore, where we don't have enough people. However, we shouldn't just be talking about mundane low-end work, because that's not going to help them. And more importantly, we shouldn't just be saying, okay, because we need to retrain, upskill them so that they are relevant, right? So this solution seems to be, all right, we'll take the surplus labor and we retrain, upskill so that they can fit into the packs. However, we argue that there's a flip side to it, and that is many of our older workers have skill sets and life experiences that are irreplaceable. So what work needs to do is cater to their needs and their strengths. So we are calling for more attention to be placed on creating job opportunities and roles that will leverage the strengths and the experiences and the value propositions that older workers bring to the workplace. So so flipping it, the other way around, I think that's certainly, to me, I think that's a more exciting proposition, because then we're not saying that, there's no agency in how we run organization, right? That's ridiculous. We should always have agency. We should always look first at the human capital and ask the critical question: what can the human capital bring? What is the value proposition here? And then, work opportunities for us to leverage these very important, invaluable assets.
Thank you very much. I think that's a great point, and it's an excellent point on which to end. I'm sorry for the people who we didn't get around to these specific questions, but we've gone over time. So thank you, Paulin and Micah, for staying over time. Obviously, and this was a great example of the impact of research, doing impactful research here in Singapore that has immediate and direct implications for social policy and how we conduct ourselves. So thank you for such an excellent example. Just a couple of things, housekeeping things. I want to remind people that there will be a survey satisfaction poll after this. I'd also like to thank BJ and Erica, who are our tech people who've been in the background. But a definite vote of thanks, a final vote of thanks to Professor Straughan and Mr. Tan for a very useful presentation. Thank you.
Thank you so much, Nigel, and thank you, JCU, for inviting us. And if there is any further questions, just email us, right? Go to the ROSA website at SMU, just email us, join our newsletter, and stay in touch with us. And we collect a lot of data because we want to share information, right? So come be part of our community. Thank you very much.
Thank you. Good night, all.
Thank you.
Good night, everybody.
Bye.
Bye-bye.
Thank you, Micah. Bye.
Bye.